for being here today. We're going to have an invocation by Mr. Larry Hopper. He's a trustee with the Fountain of Life Church. Let's welcome him to the podium. Come on up, sir.
Good morning. I promise I will be brief. How you doing, family? Oh, y'all can do better than that. How's everybody? Okay, please join me in a word of prayer. Dearest Heavenly Father, we thank you for this day. We thank you for your grace and your mercy. We're gathered here in collaboration to continue to arrest one of the greatest scourges in the history of viruses. You have blessed us with scientists, doctors, clinical researchers, and trial participants that has helped us work many years in advance and many months in dire expediency to produce the viruses that are truly what is needed to stop this disease in its tracks. It was you that placed the atoms, the molecules, the compounds within the reach of these highly skilled, knowledgeable, and brilliant people. You gave them the inspiration, the faith, and belief that brought these vaccines to fruition. Now, Father, we ask that you bless, encourage, and provide discernment to those not yet vaccinated, and undergird those within the ark of protection to reach out with courage, faith, hope, and love. But the greatest of these is indeed love. Love for our children, our seniors, our brothers and sisters, and our fellow human beings. Love enough to protect ourselves so that we may protect the ones we love, and that love is all-inclusive. All of these things we pray. Amen, amen, and amen. Thank you.
Thank you so much, Mr. Hopper. So now I'm going to bring to the podium for an opening address the visionary behind today's session. He really never allows me to do a comprehensive introduction of him, but I'm going to take MC privileges today because it is relevant to some of the key audiences we're trying to reach, and that's our young people. We really need them to lean in and listen, so here goes. After attending Missouri Valley College, he enlisted for 3 years in the United States Army and served in the Gulf War under Operation Desert Storm. After the Army, Mr. Powell started a career as a sports and entertainment executive. In 2000, Powell became vice president of the firm, an entertainment management company in Beverly Hills, California. Because of his work, Powell has been recognized for his community leadership and in giving back to the Phoenix community. And Corporate Choice Award from the Black Chamber of Commerce of Arizona, the Dr. Martin Luther King Living the Dream Award, the Whitney M. Young Award from the Greater Phoenix Urban League, the Edward M. Kennedy Community Service Award from the American Association of Access, Equity, and Diversity, the HeroZona Grand Marshal for the 21st Annual Phoenix Veterans Day Parade, and the ABC Salutes Veterans Award. And finally, most influential man in the Valley. He's the CEO of AP and Associates and founder of the HeroZona Foundation. He's a U.S. Army Gulf War veteran who was the first to lead the largest COVID testing operation in the country when the pandemic hit us in 2020. He still continues to fight and serve his country through his community work. Please join me in welcoming Mr. Alan A.P. Powell.
I just want to thank people who helped put this together today. I want to thank Javon and his mom, June. I want to thank all you all for being here today. I see a lot of the stakeholders who've been on the front line with us, Mr. Dean from the Urban League, Prentice, 100 Black Men. I see my lady over here that's representing 100 Black Women, Diane Williams. I see Robin Reed here, you will hear from in a few minutes, who heads up the Black Chamber of Arizona. And we even got my buddy from Chandler come on down to help us out today and support us, O.D. Harris. Today is really important because so many young people are taking this thing for granted, and this thing is real. Either you're going to be part of the solution or you're going to be part of the problem. I know you hear all this different rhetoric, and you hear this and you hear that. So I just wanted to have a conversation today so you didn't have to hear from the media, you could hear from the medical experts. So just want to say thank you. God continue to bless you. God continue to bless the United States of America. Thank you.
Thank you, Mr. Powell. Next, I'm going to bring up some special invited guests who will take about 2 minutes each to share some greetings with you. First, please join me in welcoming the Honorable Mayor of the City of Scottsdale, Mr. David Ortega. Let's welcome him up.
Welcome everyone to Scottsdale. Thank you, gracious hosts, for hosting this meal together and this time together. A year ago, we had a lot of uncertainty and there was no vaccine. The vaccine rolled out when I took office, actually around January and February. And there was eligibility. You had to be over 65. And although people were aching for the vaccine, it couldn't arrive to them because of their age and because of the production of the vaccine itself. Well, now, today, things have opened up, of course. We're at about 60, just over 60% in Scottsdale. That's pretty good, but we've still got about 120,000 people to go. And we're fighting two things, the COVID and time. So time is where we're at right now. I have the urgency to say, as mayor, and knowing what the health community says, Mayo Clinic, Honor Health are telling us it's coming strong. So I'm here to urge people between the ages of 25 and 55, that's the passed over group. Many of them were ready, willing, and able, but they couldn't get it when it first rolled out. So I encourage everyone to think of what we want as a community. Scottsdale's known for 5 things. We're a beautiful city, we're a clean city, we're safe from our police and fire, and we're health-minded in physical, mental, and educational goodwill. So we need to work with that perspective and reach everyone we can, because let's just not hesitate, let's vaccinate. Thank you very much.
Thank you so much, Mayor. We appreciate you. Next, we want to welcome our good friend, the chairman of the supervisors with Maricopa County Supervisor District 1. Let's please welcome Jack Sellers, ladies and gentlemen.
Good morning, and what an honor it is to be here this morning with this distinguished panel. I personally want to thank A.P. Powell and Mayor Ortega for including me in this group, because this is such an important topic. And I'm not going to take a lot of time to speak this morning because we have experts here that you need to listen to. But let me just tell you a little bit about why I am so heavily invested in this. I think you all know that Maricopa County has the regional public health authority. And so we have a lot of responsibility for this particular region. And so we get frequent updates. Our board gets frequent updates from Dr. Sunshine and Marcy Flanagan, and they very openly answer any questions or concerns we have about anything that has to do with how we're handling this pandemic. All I can tell you is that vaccines are available. They are probably the safest vaccines we've ever administered and one of the most effective vaccines we've ever administered. And we just need to get people on board so we can stop this and get back to a more normal kind of lifestyle. So please do what you can to help support getting people vaccinated. And I'll just give you one quick point on one of the kind of things that we're doing in Maricopa County. You know, we're recognizing that there are some groups that perhaps have communication problems or access problems to vaccine, and we're trying to get people out to those areas to address that. A quick example is that, we set up a site in Mesa that was administered by the Korean Nurses Association. So they had translators there for, I think, 3 or 4 or 5 different languages. We had nurses there that could explain to everybody what the vaccine was, why it works, and why it's safe. And we're doing more and more of that kind of thing. So if you know of places where we could do something like that that would be beneficial, please let me know. So thank you.
Thank you, Supervisor Sellers. Next, we have the President and CEO of the Scottsdale Area Chamber of Commerce. Let's please welcome Mr. Mark Stanton.
Good morning, everybody. Thanks so much for being here. And June and your team here at Loyalty, thank you so much for hosting us. We have a wonderful panel. We have some very esteemed leaders. Mayor Ortega, thank you for being here in your words. And Chairman Sellers, thank you so much. I represent the Scottsdale Area Chamber of Commerce. We've been around since 1947, well over 1,000 members. We represent everything from manufacturing to healthcare, finance to retail, and everything in between. Our borders go from North Scottsdale all the way to South Scottsdale with the Air Park, with Old Town, and everything in the surrounding area. And I will tell you that the pandemic was devastating. Devastating on the health front and devastating on the economy. These businesses offer jobs, they provide income, and most of all, they help build a community. So on behalf of those businesses that want to stay open, that want to engage in commerce, we say please, consider the vaccine, get the vaccine, follow the experts. Let's keep the economy moving forward, let's keep businesses open, and let's keep this community moving forward. Thank you for having me.
Thank you, Mark Stanton. I just want to identify Dr. Stephen Pointer. Are you here? Okay, we'll bring you up in a minute. All right, finally, please join me in welcoming the President and CEO of the Black Chamber of Arizona, Mr. Robin Reed.
Good morning. I know we don't have a lot of time. I want to first just thank AP, Ron Williams, Aaron Bear for the great work they've been doing on this initiative since day one. This is we're meeting here today. They've been doing this very hard work for nearly 2 years now. You may recall, but they were one of, and I'm sorry, they might have been the largest COVID testing site in the country over the last couple of years. I also want to thank our esteemed panel and Dr. Chris. Love the announcement of your new role and excited that we're going to be able to keep you here in Arizona. So what I want to talk about is how one community has been bridging divides from the very beginning, bridging the political divide, remembering that this is a healthcare issue, this is not a political issue, bridging the racial divide, this is not a black or white or Hispanic or Asian, this is a healthcare issue, bridging the youth divide, helping us understand we can't separate a small segment of people out of this because this is of significant concern to us. So I just want to take a minute and thank them for the incredible work that they've been doing from start to finish and for allowing us just to be a part of that. Thank you.
Thank you, Mr. Reed. Next, we have somewhat of a testimony, and we're going to take a minute to hear a testimony from someone that our founder met, Alan AP met, who had a compelling story to share, and he shared it with AP and asked that he take a quick minute to share his story with us, which is relevant to today. Dr. Stephen Pointer was born and raised in Chicago. He worked on Wall Street in Chicago for 10 years, been in the finance business for over 26 years, in the entertainment business for over 20 years. Him and AP connected on that. Dr. Pointer received his honorary doctorate in business management and specializes in business and entertainment. He has been a resident of Scottsdale, Arizona for 14 years and a pillar of the community. So here's the relevance to today. He was one of 5 siblings, 2 of which preceded him in death. There was Apostle Dr. Outlaw, Renee Pointer Williams, and now for his last 2 siblings, Christopher L. Pointer, deceased, COVID-19. Warren L. Pointer, deceased, COVID-19. Please welcome Dr. Stephen Pointer.
Greetings and good morning, everybody. Thank you for having me here. First of all, I want to thank the mayor. I want to thank the city of Scottsdale. I want to thank Loyalty Lounge, June, Durr, her son Javon. I'm here this morning just to tell you guys how blessed I am to be alive. I'm the last surviving brother. My mom died 3 years ago. My dad died 4 years ago. My oldest brother, Christopher L. Pointer, died last July, and Warren Pointer died Memorial Day, both of COVID-19. I'm blessed to be here, and I'm excited. I don't want to see sad faces. I want to see happy faces because God allowed all of us to be here. We're here for a purpose and a reason, and we're thankful to God to be here. And I want everybody to be encouraged to stay strong, keep fighting. We're blessed to be in this position where we're here to be at Loyalty's Lounge. We're here for a reason. Stay strong, vigilant. Whatever it is, make sure you listen to the medical examiners, the medical professionals when it comes to this virus. It's real. Don't give up. I got hope for us. And stay blessed and be safe. Thank you, everybody.
Thank you, Dr. Pointer. Okay, let's get into our program. I want to thank all of our special guests for being here and sharing their information with us. Now for our moderator. Our moderator, a doctoral student who I call the future Doc HB. He's a speaker, trainer, entrepreneur, and poet, and a proud Phoenix, Arizona resident who grew up on the west side of Chicago. His life story was featured in an MTV documentary. He's the founder of one of the largest country open mic poetry events called Homebase Poetry. We can't thank him enough for taking the time to moderate today's important discussion. Please welcome Harold Branch III.
Good morning. So I'm excited to dive right in. Obviously, we have some important things to discuss. Allow me to formally introduce to you your panel, Dr. Wooten, President of Wooten Healthcare Group, Dr. Chris, Director of Arizona Department of Health Services, and Dr. Baker, Medical Director, Equality Health. So I have some prepared questions for you all, and we're just going to dive right in. And if I could lead with Dr. Chris, if you could begin this portion, if that's all right. Are vaccines safe? Let's just get right to it. Are vaccines safe?
Yes, so the vaccines have been proven both to be very, very safe and effective. The CDC has been doing lots of follow-up on the millions of United States citizens that have received this vaccine. There have been very, very few side effects, and there have been even more rare serious side effects. So the vaccines have been proven to be safe.
Excellent, thank you. Any input, Dr. Wu?
I can just add that, vaccines as you say, I want to put in perspective just how safe they are. They're probably the safest vaccines we've ever had. Mm-hmm. Most vaccines have been extremely safe. To put it in perspective, I get people all the time saying, well, I've heard that, I think you're going to delve into that a little bit, I heard that people have died from the vaccine, etc. Really, there have been more people who died from taking Tylenol in the last 12 months than the vaccine. And that's really important to understand. And I understand my mic. Make sure that your mic is on. Is that good? Nope. It is the volume. It's not. I've never been told that it's hard to hear me. So, I've never been told to be a silent person. Okay. Is that better?
Yeah.
All right. So I just want to add that the vaccines are extremely safe. Again, we don't really press that enough, because that's really one of the number one topics young people in particular when they come to my office ask me about.
Thank you very much.
And one last thing, what we're competing against is Dr. Instagram. We're competing against Dr. Facebook. So please consider the source where you get your information.
Without a doubt. Thank you very much. We share a microphone, so it's like a concert. Okay. Me and you. You, Jay-Z? Sounds good to me. So, there's a new variant out. Are the vaccines effective against the Delta variant?
So the vaccines are effective against the Delta variant. There is information out there that it's not as effective, That's not true. What we have seen is that the vaccines work against the variant. They protect against hospitalization and death, which is really what they're designed to do. So while you may hear about breakthrough cases, that happens with every single vaccine. But the people who are vaccinated are not ending up in the hospital and not dying at the same rate where those that are unvaccinated are.
Yeah, I just want to reiterate what she just said so it's not missed by everyone listening. Vaccines, the purpose is to reduce severity of disease, number one, and to reduce death. Nowhere in it is it to reduce or have people never get the virus. So to have a breakthrough case is not something that we didn't expect, but what we're hoping for and what we have seen is that people who have been vaccinated have milder diseases and go home at a much quicker time and recover and go back to being normal again.
To put that in perspective, as a pediatrician and adolescent medicine doctor, I always want to bring the kids into it. When we first came out with varicella vaccine years ago, we got a big pushback from everybody, including physicians. Why are we giving chickenpox vaccine, varicella's chickenpox? Why are we doing that? My kids got chickenpox. They got a little mild, little rash. They went to school a week and a half, 2 weeks later. Well, we weren't trying to prevent chickenpox from ever happening. It's only 88% effective. But what we did prevent is the secondary effects of chickenpox: encephalitis, varicella encephalitis, varicella pneumonitis that killed children. And no one knew that, and no one talked about that. We pediatricians knew about it because we'd have a case every so often in the ICU that we'd have to pronounce. So again, you got to look at the great picture. The vaccines prevent significant morbidity and mortality, and my goal is to keep you alive.
Thank you. Now, with this Delta variant, I think we all have been hearing more about young people, children, being affected and having more dire results because of it. Dr. Wooten, if we could start with you because of your work with children, how is this affecting children through this Delta variant?
We pediatricians, people who take care of children, were lulled to sleep initially with the Delta, the COVID illness, COVID virus, because we were like, oh, that's just for, parents, don't worry about it. Children are not going to get it. It's mostly the elderly, mostly in nursing homes, et cetera, et cetera, et cetera. We bought the sauce too. We pushed it. We made sure parents were reassured. And then because we didn't get the numbers of people vaccinated that needed to be vaccinated, you got to remember viruses like to morph. They like to change. They like to mutate. That's what viruses do. And you give them a host that's unvaccinated, and they get in your nasal pharynx and your sinuses, and they morph. I call it a dance party. They have a dance party inside of you. Even though you're vaccinated, even if you're vaccinated, you still can harbor the virus. But what it does in an unvaccinated person, it mutates, it changes, it grows, and all of a sudden you're sneezing on one of your coworkers who have children, and guess what? The children are now susceptible to the Delta virus much more than they were ever susceptible to the Alpha virus or Alpha COVID. So now we're having children and young adults, the ones that couldn't get the vaccine initially, who then were told, oh, don't worry about it. They're the ones that are getting ill now. And yes, we have children in pediatric ICUs. And I have one 14-year-old I just saw who ended up having myocarditis, a 14-year-old having myocarditis. And it was on chronic medication for that now and had to be followed significantly close. So again, we have to understand the Delta variant got power. And it's got power now over young people and young adults. And so we really got to re-educate these young people in particular.
Thank you. Dr. Chris?
Well, and I think that what Dr. Wooten said is absolutely correct. And the problem with it is not only does it impact our young people and our children, but that's our highest unvaccinated group as well. So anybody under 12 is not eligible to be vaccinated. There's no protection for them except for getting all of the adults around them vaccinated and keeping them safe. Our 20 to 44-year-olds are one of our lowest vaccination groups here in Arizona. And again, that goes back to it didn't seem to impact young people at first. We knew that it impacted our nursing homes and our elderly. They're almost 90% vaccinated. They've bought into the vaccine, and we are seeing less of them being hospitalized because of COVID, and it's pushing down into our younger generations. We're seeing people in their 20s, their 30s, their 40s, their 50s that are having severe outcomes and being hospitalized, going into the hospital wishing they had been vaccinated to prevent that.
Imagine a lunch table in your neighborhood elementary school. There's 10 kids sitting there like they're going to do for lunch, mask off eating. During the flu season, before COVID came around, one kid has a flu, he's going to infect one other person. That's how contagious the flu is, okay? When COVID came, we realized that COVID was more contagious than the normal flu. For every one person with COVID, so this one kid now has COVID, he's going to affect up to 4 people. And this is the old COVID, right? But now with the new variant, the Delta variant, it's not more deadly, but it's more contagious. So that one kid now sitting at a table of 10 can affect up to 6 people. And just think about every one of those kids leaves and affects 6 more and 6 more. That's the problem with this variant. We need to get it under control.
Thank you. Thank you. And Dr. Chris, you touched on it a little bit as we're talking about children and how do we protect children that's too young to get the vaccine, right? I believe that you said just kind of get vaccinated around them. Are there any more tips that we can utilize for the children and things we can do to help keep the children safe that can't get the vaccine quite yet?
Absolutely. So you want to make sure that all adults and all eligible people to be vaccinated around your kiddos are vaccinated. I vaccinated my 13-year-old. I didn't personally do it. He wouldn't have allowed me to. But my 13-year-old is fully vaccinated. I trust the science. I trust the vaccine. I trust that more than I trust COVID. But you want to make sure that all of the adults are vaccinated and that the kids, when they are with people they don't live with, that they are wearing masks, washing their hands, and it's really, really important to prevent this spread, to keep your kiddos home when they are sick, and to prevent that from spreading to others.
Excellent. Thank you.
We learned that the first time around, right? It's mask, social distancing, right? Washing hands. They have not changed. We need to continue that until we have this under control.
And as soon as we have people protesting washing hands, we're in dire straits. We're in a rough place as a nation. Can you all, would you all be willing to speak to the indirect consequences of COVID? I hear people say that, well, that person didn't die of COVID or it wasn't COVID, but from my understanding, because of the hospitals and people being overworked and understaffed, there are some consequences just because of the rise in hospitalizations.
When filling out death certificates, it's especially in this state, it is a very specific thing. You have to list everything in order, right? There's no place on there to make up the diagnosis. You have to be able to support it, right? So when I hear this by people, oh, people are just saying it to get more funds, there's no funds to be had, right? The vaccine is free. All the work that we've been doing, if I'm not getting paid by my company, I'm doing it for free, right? There's no money to be made in this. Now, pharmaceutical companies, yes, but none of us, we're not paid into the system. I'm doing this because I want to protect my family and my loved ones. I just buried a cousin less than 2 weeks ago.
Wow.
And from COVID, you know, this touches everybody. This is not a zip code that it stays away from, not a social economic group that it stays away from. This is everyone here, everyone that can hear my voice, everyone that can stream this. This will affect you. Let's get ahead of it.
And I can touch a little bit on the hospitalization. I just want to thank our healthcare workers who have been working tirelessly. They are the heroes, and they are tired. We've had 2 major surges where our hospitals were filled with COVID patients, and COVID patients take a lot of time, they take a lot of resource to save their lives. We are now in another surge, and what happened during the previous surges was hospitals were so overwhelmed with COVID patients that other patients that had chronic medical diseases or surgeries that needed to be done were put on hold. So all of those individuals with healthcare problems started finally receiving care back in like March and April. Our hospitals are still trying to provide them with the care that they need as we're entering into this third surge of hospitalizations. So we know that we've got, tired healthcare workers that have been doing a phenomenal job. We have less of them. Arizona was already in a healthcare shortage state before COVID. That has exacerbated this with COVID has made that much worse. We know that the entire country is experiencing a surge. So when we would normally rely on getting traveling nurses from out of state, every state is trying to do that right now and bring those nurses in to take care of their residents. So the best way to stay out of the hospital is to get vaccinated, and the best way to protect our healthcare workers and our healthcare force is to make sure that you are vaccinated and not needing hospitalization level care.
Thank you.
I really don't have anything else to add to that. It's been very, as a health provider, and people who know me know I work every day, and I'm on call 24 hours a day, 7 days a week, and I've been doing it for 38 years. And people go, how in the heck do you do that? I do it because I have passion for what I do. I do it because I care about those 40,000 families I've taken care of in 38 years, and I take great pride in that, but it's been exhausting. I've never been so mentally and physically exhausted in my life. And I'll say it in front of you. I use this when I talk to my adolescents in particular who don't like to go to class. I have never been out sick a day in my life. Seriously. I've been practicing medicine 38 years. I've never been out sick one day. That's a true story. And I don't know how that's happened. I really don't. But knock on wood, God's going to grace me enough to continue to do it for a few more years at least. But I'm going to tell you this. It's been a struggle to look at people in the eye and have the passion for their life, sometimes more than they do for their own lives, and try to teach them why it's important to get this vaccine. And I'm going to just tell you a little anecdotal discussion that I had with a 17-year-old African-American male who came to my office last week. And I won't forget this because he's a new patient. I never met him. His mother saw me on something, the news or something, and wanted to bring her adolescent to me. Young man, handsome young man. He came in because he had a bad sore throat and a bad headache. Long story short, I ended up diagnosing him with the sinusitis, and I said, I'm going to have to treat you with an antibiotic. He said, thank you, thank you. And then he went in to say, his mother said, Dr. Wooten, will you talk to him about the vaccine? And I'm like, well, what do I need to talk to him about? He's a minor, and you want him to get the vaccine, right? And she said, yeah, but he doesn't want it. And he then looked at me and went into how it's the government's way of trying to control people. And he went into this whole diatribe. And that he didn't trust us and he didn't trust the vaccine. And so I said, well, so obviously you think that I'm going to give you something like a vaccine for COVID that's going to hurt you? He said, that's right. I said, so then obviously you don't want to take this antibiotic that I'm going to give you for your sinus infection, right? And he stopped and looked at me and went, yeah, because the same doctor who you trust to give you that antibiotic therapy is the same doctor that's preaching to you how important it is to get the COVID vaccine. And he looked at me like, no one's ever told me anything like that. It makes sense. Yeah. And so he went to get the COVID vaccine. So the bottom line is the disinformation is real. And as long as I have breath, I'm going to talk it down as much as I can. But we need everybody's help to do so.
Without a doubt. And we're going to touch on some of that disinformation here in a moment and social media and what that's done to this topic. Before we dive into that, a quick question, if one of you can help me with, when a person has contracted COVID and get past their 10 to 14-day quarantine, when can they then get the vaccine?
Yeah.
So once they are past their 10 to 14-day quarantine, they can get the vaccine at any time. unless they received monoclonal antibodies or the plasma, because then you have to wait 90 days. But otherwise, you can take the vaccine as soon as you are able to go back out into public.
Excellent. Thank you.
Great question, because if you've had COVID, you still need the vaccine.
Yes.
On my page this morning, and as I was getting ready for work, a young lady was streaming live from the hospital on her second round of COVID. Second round. She had original COVID, now she has the Delta variant, and she's asthmatic, right? So she's struggling for air, lips blue as she's talking and streaming live, telling people to get vaccinated, which she didn't do because she thought she was immune to getting the Delta variant, which proved not to be true. So please, get vaccinated, even if you've had COVID.
Wow. Thank you. So having COVID doesn't vaccinate you.
Right.
It's not like an automatic. Okay.
No.
Good to
A
know.
lot of people think that you get that, natural protection.
Oh yeah, I've heard it.
From what we've seen is that people can get COVID multiple times. And so while it may provide a short, very short, brief protection, the vaccine is the best way to protect yourself and your family against against COVID.
And I would assume that even if it's mild the first time, it could be much more severe the second time.
Absolutely.
So as we talk about disinformation, let's speak about some miscommunication or mixed messages, I would say. How does one filter through what they perceive to be mixed messages from government and medical experts? You can always find somebody to say the other side of the story, even in government and the medical industry.
It's tough because some of those medical experts use data that does not tell the complete story. And those who are not scientific, you're not going to pick up on those cues. So what I try to do and what I try to encourage churches, community groups, community organizations to do is to find trusted medical people to be your spokespeople, to talk to your group, and to get a relationship. So I'm not coming in as a stranger, right? I have a vested interest in seeing everyone do well. Find those people and have them speak to you using data, and take time. Don't let it be me sitting up here talking to you. When I come talk to your group, I want to be in a conversation. I want to be sitting amongst you. I want to answer questions just like we're at the dinner table, right? Because that's where we're going to get people off the fence, and that's where we're going to get people just on the other side of the fence to really start hearing the truths about COVID, about the vaccine, and about how we're going to get back to our new normal.
Thank you. Thank you. I want to take some time to address some of the things we've seen on social media. And how many of you have heard some interesting theories on where COVID came from? I think for me, the most interesting was that there were nanites in the vaccine so they can track us and know where we are at all times. But while the person was telling me, she had a smartphone in her hand. So I question her commitment to conspiracy theories. I don't know how committed she was. So let's address some of these things, because even though some of us may seem, oh, that's ridiculous, that can't be the case, some ridiculous things have happened in American medical past. And so we have to address them seriously. Number one, if you all can speak to, does vaccines affect fertility?
Well, we have two OBGYNs up here on stage. It does not affect fertility. There's been numerous statements put out by the American College of OBGYN, as well as the American Academy of Family Practice. There is no proof anywhere that it affects fertility. There's not any vaccine has ever been proven to affect fertility. And it's just like any other vaccine. So again, consider sources. I've seen some of those videos. You know, the one video that shows these little metal spiral things going after the women's eggs. I mean, who knows where that came from, but that is not the vaccine.
Okay.
Dr. Baker is exactly right. There has been no evidence that it impacts either male or female fertility, so it is safe. The one thing that we would caution our young population is, if we want you to make it to the age where you can have children and, start a family, and COVID actually may be a bigger preventer of ongoing life and fertility. So we want to make sure that we're doing everything we can to protect everybody.
Absolutely. All right. We only have a couple more minutes, so we're going to flow through a couple of these. There is a belief that the vaccine side effects have killed many people. The vaccine side effects have killed many people. Dr. Wooten, would you like to?
Well, you heard me address that a little bit earlier. Not true. That's the short answer is just not true. You can believe and you will believe anything you want to believe. If you go into something thinking a certain way, if somebody's convinced you of something, it doesn't matter how many degrees I have behind my name. It doesn't matter about anything. If you don't trust the information that I'm giving you, then you're going to believe what you want to believe. So I always tell people that, because at least I'm blessed enough that most of the people who come to me believe me, I hope. Just look at the data. I'm data driven. If you want to believe something, and don't look at data based on what you saw on the internet from Joe Smo. Look at data from the CDC, the American Academy of Pediatrics, etc. Because everybody can put data out there. I'll give you one of the biggest fallacies in the world that happened. Not that long ago, I know some of you probably heard this, that some vaccines may cause autism, right?
Absolutely heard.
How many of you heard the end of that story? How many of you heard the end of the story? Because the doctor that printed that article, that great piece of research data, printed in the British journal called The Lancet. Now, the American doctors, we have this love-hate relationship with each other. If you want to present data, we scrutinize the heck out of it. You got to reproduce it, and then reproduce it again, and then a panel of people like these sitting up here review it and say, is it appropriate or not to print? No. Or yes. And then it gets printed, and then it's considered gospel and medicine. But that's not the rest of the world. And so this article was presented by this physician who we later found out made it all up. You didn't know that, some of you didn't know that he got indicted for false information regarding vaccines causing autism, and I've been dealing with it ever since. I have patients who come in, I'm not getting vaccines. And just to add to that, the COVID vaccine hysteria has melted over into regular vaccines. I track the percentage of patients of mine who refuse vaccines because it's like the kiss of death to me. A part of me dies when a patient says, I don't want vaccines for my children. It really does. Because I'm old enough to have seen what happens in the pre-vaccine world. I've treated meningococcemia. I've had to amputate the legs and the arms of an 8-year-old who had meningococcemia and pronounce them dead. Not many people have seen that disease since the early 80s because of why? Vaccines. I'm preaching now. I'm the grandson of a minister. My grandfather was a minister for 50 years in this town, so I got that in me. So that's what I've been combating, is you haven't seen these diseases, so you've been lulled to sleep because of vaccines. 18% of my population refused vaccines pre-COVID. It's up to 29% now. Wow. So I have 29% of my parents coming in with their newborn babies and say, refuse vaccines. Unbelievable. Right. That's what we're fighting against. I know that was a little longer than you wanted, my moderator. No. But since I'm his former pediatrician and his children's pediatrician, I can pull rank on him.
I got a healthy boy at ASU because of this guy. And so go ahead, you can do your thing. No, appreciate you, Dr. Wu. Really do.
And to extrapolate on other things people say, the biggest thing I hear is, I don't know what's in it, right? Think back to what Dr. Wooten said a minute ago about treating with antibiotics. How many people know what's in the antibiotic? Nobody here, right? So I talk to my patients now, say, well, okay, let's talk about that. What medicine do you take every day? And a lot of people are really healthy or try to be health conscious. They say, well, I'll take a multivitamin. I say, okay. And it's a good thing they say that because I have 2 slides in my office, right? I have one slide that shows the ingredients of a multivitamin, and then I have a slide that shows the ingredients of the mRNA vaccine. And quite frankly, if you look at the ingredients of any multivitamin, it's kind of scary, right? It's a bunch of Latin words that nobody knows what they mean, and there's about 20 or 30 of them in there. And if you look at the vaccine, it's about 7 Latin words. It's a lot less than the multivitamin. And when I show that comparison and contrast, a lot of people say, well, I really don't know what I'm putting in my body anyway, right? So, as he said, trust a trusted source, right? I vaccinated my entire family. You know, I would not have vaccinated my child if I didn't believe in the technology. So please, get a trusted source. I keep saying it over and over again, but that's the key, is having a trusted source.
Excellent. Thank you. Thank you.
Well, and one of the other pieces of misinformation that I've seen on the internet and I've heard a lot is that the vaccine is experimental. And the vaccine is not experimental. The vaccine has been used for many other uses. Scientists have used this specific type of vaccine for years. Scientists have been studying the SARS and other coronaviruses for years. Because of all of that knowledge and all of that experience, they were able to put this vaccine together very, very quickly in order to save lives. But the vaccine is not experimental.
Thank you for addressing that, because that's definitely something I heard as well. And I want to acknowledge Dr. Wooten. From my understanding, you may have to cut out here in a few moments. We got one more question.
We're good.
One more question. I'm gonna let you all go. And Dr. Baker, if you could lead this question, that would be great. And I also appreciate you for extrapolating. So hopefully y'all got that out of the conversation in his last answer. Thank you. You're great. It's been reported that the vaccine rates for minority populations are much lower than they should be than for other communities. Can you speak to that piece of it, especially the Black community, the Latinos, just all of the minority communities? Can you touch on that a little bit?
Absolutely. The first time I came to a mic with Dr. Chris, I gave a small talk about disparity in medicine, right? That was when I got my first vaccine. That was almost a year ago. At that talk, I said that there are disparate communities amongst us, underserved, underrepresented, underinsured. It's the gamut. And amongst that, the biggest issue we thought initially was going to be access. So thanks to people like HeroZona and the Equality Health Foundation, through the One Initiative, we made sure that we put sites everywhere. We're in schools, we're in churches, we're in community centers. We're everywhere. When you turn around, you can find us. And if it's not that, Dr. Chris made sure that it's in every pharmacy, just about every pharmacy in town. So it is everywhere for people to get. So access has been there. Then came this whole hesitancy issue. And you spoke about it. There's a lot of reasons behind hesitancy. One that is really hard to get by sometimes is the historical context, right? Henrietta Lacks, right? This was in the 50s, and we're still dealing with her issue today. And then the Tuskegee experiment. For those that don't know Tuskegee, it started in the 40s and didn't end until the 70s. And this was government sponsored, and it was testing people against syphilis. So there is distrust in the system. And that's the reason why that we need to create a better pipeline to get people that look like myself, Dr. Wooten, and have the care for the community like Dr. Chris, to be in a place where we can really start making differences in medicine, where we can be trusted sources of information. So that when we talk to our patients, patients can understand what we're saying. They can believe it because we're going to walk the talk. I'm not going to tell you to get a vaccine that I'm not going to get. And I'm going to take the time to explain to you what's in this vaccine. So hesitancy for historical context, because they don't know what's in it, right? And because they read too much of the internet, that we have to really go back and start to unravel things.
Without a doubt. Thank you. Thank you. Thank you.
No, I really don't have anything else to add to that. You know, I spoke about hesitancy and distrust, and the only thing that we can do at this point in time is put that trust back in place. And I hope people like myself, who's pretty loud, is heard. I know you like that one. Yeah, I'm pretty loud about everything that I'm passionate about, and hopefully, more people will hear it.
Without a doubt. Thank you very much. With that being said, we're done here with our panel. We appreciate all of you. Thank you for coming and sharing your wisdom, your knowledge, your years of experience, both in school and in working with the community. Because without our medical staff, we would be it'd just be Robitussin, just everywhere. Everyone would just be swimming in Robitussin, and we need better support than that. So thank you all. If we could give a round of applause, Dr. Wooten, Dr. Chris, and Dr. Baker. And with that said, I'd like to bring up the president of the HeroZona Foundation, Brother Ron Williams. Thank you.
Let's give it up for HB, Doc HB. I call him the future Doc HB. All right, before we let everyone go, just a couple of quick announcements, and we're out of here. Really want to thank our online audience for tuning in to hear from the experts and not the media. I want to thank the HeroZona Foundation board members, co-founder Aaron Baer, Alan A.P. Powell, Heath McCarter, Dennis Prince Sr., and retired City of Phoenix Vice Mayor Michael Johnson. And thanks to Chief Walther and Assistant Chief Joe LeDuc. Thank you, Joe, for all you do. And thank Assistant Chief Rich Slavin and all of the Scottsdale PD for helping us to be safe and secure today. I just want to finally say, before I acknowledge some other people in the community, the One Community Initiative, the HeroZona Foundation, and Equality Health Foundation would really like to personally thank Dr. Cara Chris for her service to her craft, community, state, and country, and we wish her well in her new position as Chief Medical Officer of Blue Cross Blue Shield.
Thank you.
And finally, I really want to acknowledge some of our community partners of the Community Initiative, Mr. George Dean here from the Phoenix Urban League, Dr. Karen Harden, Maricopa County NAACP, Donna Williams, 100 Black Women of Phoenix, Prentice Moore, 100 Black Men of Phoenix, Charles Farnell, NAACP State Conference, Thomas Leon. We appreciate the partnership with Equality Health Foundation. Again, Chief Joseph LeDuc, Scottsdale Assistant Police Chief, Richard Slavin, Scottsdale Assistant Police Chief, Clovis Campbell, President of the Arizona Informant, Jeffrey Jerrison, Bowtie Entertainment, Tremaine Jasper, Phoenix Soul, Eugene Morris, City Buzz, Maricopa County District 2, Steve Chutry, and then finally our Chandler City Councilman, Mr. O.D. Harris. Thank you all for your partnership and support. And finally, thanks again to Equality Health Foundation, the HeroZona Foundation, and all of our partners and esteemed panelists, our special guests. Again, thank you, HB, for what you do for this session today. Today's discussion will archive this moment in the history of our nation. The decisions we make today will determine our future. History will be our judge. So thank you for joining us today. God bless you all, and God bless the United States of America.